My next guest is Toni Engram. She is a biological dentist. So I asked her to come speak to us about what is biological dentistry. And if you're curious about mercury fillings, if you have any mercury fillings and you're wondering, should I have them removed? Well, we're going to learn from her. Should you? Could you? And if you do, how to do it safely. So tune in, listen to this discussion to learn about more than your teeth, zooming out and not just your teeth, but you who has the teeth. So biological dentistry is going to look at the total person and not just the teeth. So listen to this great discussion that Toni and I will have about biological dentistry. Today on Stronger Bones Lifestyle, I have a guest that I am looking so forward to learning from her. This is Toni Engram. She is a dentist, and we are going to discuss biological dentistry. Welcome, Toni.
Thank you. I'm so excited to be here.
Yeah,
It's a long time coming.
it is. And I told you, I don't know anything about this, so I need to be educated. And I think actually we all need to be educated. So you're going to educate us.
Okay, let's do it.
All right. So start with your story, your journey, why you're a dentist, and then how did that biological part come into play?
Yeah, so I was always interested in healthcare from high school on. I have a lot of family members in healthcare, but anything holistic or outside of the norm, that was not on my radar at all. I chose dentistry because it was a good, safe, family-friendly career choice as a woman who wanted to start a family and not have to go through a few extra years of residency, which is a questionable reason to make a career choice. But that was my decision-making at the time. I knew I wanted to start a family as soon as I could. And so that's what pointed me towards dental school instead of med school. And then along the way, I found myself fairly easily burned out by dentistry as a profession, as I think a lot of healthcare practitioners are. It can be really frustrating when we're given the tools to fix, but the fix is only temporary. And so I could fix and fix and fix teeth. And then I noticed that patients would come back and they hadn't made any changes to their diet, to their lifestyle, to what they were doing when they weren't in my office. And so they would come back and have the same problems over and over and over again, sometimes on the same teeth, the same tooth that I had just fixed. And that would kind of hurt my feelings. So I would say I was a busy dentist that was just a little bit discouraged by the process. And then it was, I forget what year it was, like 2010, 2011. And I was a young dentist. I was working full time as an associate, and I was also building my first practice from scratch. I had a toddler at home. I already had my first kiddo, and I just got super, super sick. I was sick and I had signs during my first pregnancy, and I just didn't know what they were. But this time around, I was really sick. I had some GI issues and some unfortunate tummy trouble, and got to where I couldn't keep down any food, even water. Like drinking a glass of water would send me immediately to the restroom. I started losing weight. And so it took several months to get doctors to take me seriously enough that there was something other than just, you're stressed out, you got IBS kind of thing. So finally, after months and months of being sick, I was diagnosed with Crohn's disease. And then I was given, your very standard Western medicine answer. Here are your medications that you'll need to take. And you're going to be on these medications until they stop working. And then we'll put you on some stronger medications. And, oh, by the way, there's a 40% chance at some point you're going to need surgery to remove all or part of your colon. And I was like, well, that sounds awful. I was 30 years old. I was a young mom. I was starting a new business. I didn't really accept that answer. And so at one point I asked, I was like, well, what should I be doing? What should I eat to heal this and make this get better? And the doctor looked me right in the eye and he's like, Toni, there's nothing that you can do. It just is what it is. He's like, your diet has nothing to do with this. And this is, I know, right? Like, all of you watching, if that doesn't sound like the most idiotic statement you've ever heard from a very smart, educated person, then I don't know what does. So thankfully, my mama raised me to be pretty stubborn, and I didn't accept that answer. I went home and I started digging, and I did all of the research that I could do to figure out how to actually get well. And Crohn's disease is, it's an autoimmune condition, but it's very inflammatory. And one of the key causes is a dysbiosis, this imbalance in bacteria in your gut. And so the more I learned and the better I felt after making some changes in my diet and my lifestyle and how I handled stress, I realized, this is exactly what I treat in my patients every day. I treat inflammatory conditions like gum disease. It's the most common, one of the most common diseases that I treat. And I treat, tooth decay. Both of those they're basically an infection. It's a dysbiosis in the bacteria of your mouth, which is the beginning of your gut. So I just said, man, if I don't figure out how to solve this for my patients also, then what kind of healthcare provider am I? And so that's what kind of led me down the rabbit hole of studying the links between oral health and systemic health. And then, really, the more I started talking about these things with patients, addressing their nutrition and looking at more preventive strategies, it was really my patients who started nudging me the rest of the way over towards the more holistic biological dentistry. And they would say things like, okay, well, Dr. Engram, if you are speaking this way about nutrition, what are you doing about the fluoride that you're putting on all your patients? Have you looked into that more? And then, Dr. Ingram, you say you want to, remove all of these toxins from our diet and from our environment, but what are you doing for yourself and for your employees when you take out these fillings that are half mercury? Are you protecting yourself in any way? And so it was really my patients who encouraged me to keep doing research and to really dig into the world of biological dentistry.
Okay, so before we get into that, you have said so much. And as you're talking, I said to you before we came on live, I don't know anything about biological dentistry. I have so many questions. But before we even get to there, so I specialize in bone health, you specialize in teeth, and they're both made from similar substances inside the body. The teeth are in the bones, and there's a whole lot there when it comes to the jawbone, because in the osteoporosis world, the medications can cause osteonecrosis of the jaw, which I want to know at some point if you have ever seen that. But as you're talking about your journey and uncovering some gut issues, and then you said the word dysbiosis, and I want to just clarify that we have gut microbes in our gut, we have good bacteria and bad bacteria. But when we say bad, it's because they're autoimmune triggering. And so we have to have this internal balance. And then you use the words inflammation. Well, osteoporosis is an inflammatory disease, which, just like you said, and then you spoke about your doctor and how it's so sad, actually, because really, we've been controlled by big pharma, big insurance, big food. And so that's who funds the medical schools. That's who trains the doctors. And so they're just going to train them to find the disease and give them the pill. So it's just unfortunate, the whole training of it all, right? But just the fact that you have a disease that is actually dietary, like the gut plays such a critical role, that you couldn't be helped by your doctor. And you were so smart and so curious to question all of this. So yeah, I saw so much correlation in what you just said, because yes, the mouth is the beginning of the gut. And for me, gut health, and you can't have a healthy bones without a healthy gut.
That's right.
So, okay, so then biological dentistry, because really what happened is you expanded as a person and as a dentist, right? You took this beyond, it's almost like there's a microscope view where you're just looking at the teeth. And now you backed up and you're looking at who has the teeth and what's the health of the person with the teeth. So that's what I think biological dentistry. Who's the person with the teeth?
Yeah, yeah. I love that. And I've always loved the term holistic more so than any other term, just because I think it's the most accurate description. I'm looking at the whole person and not just one isolated body part or one isolated system, because there is no isolated system really. But I would say the most practical definition of a biological dentist is that I am the dentist version of a functional medicine doctor or an integrative doctor, or even, there are some people who call themselves biological physicians as well. So the more naturopathic version of dentistry. I still have a dental license. I still practice standard of care dentistry. I just try to go beyond the standard of care. And so that means I'm really careful with the materials that I use. We're very intentional. I don't use any fluoride in the office, and for reasons we can get into down the road. I obviously don't use any mercury, and we're very, very careful with how we handle mercury that's already in our patients' mouths. There are some specific protocols that we use to remove those fillings safely in a way that doesn't expose myself or you or my assistant to any mercury in the environment. So we're intentional with how we do things, but the what of what we do is often the same. I focus a lot on prevention and nutrition. We've talked earlier, I'm a certified integrative health coach, which was a really fun program for me to go through. Obviously, I'm not seeing patients just as a health coach, but I do coach my patients in a dental environment. I feel like that's my job. And so that's kind of the practical, what the heck is a biological dentist? We're the more naturopathic version of your friendly neighborhood dentist.
Yeah, you're taking care of the whole person and you're doing the preventative part, which is great because you said that you see a lot of periodontal, like gum inflammation, right?
Yeah.
Question about mercury fillings, because a lot, I mean, I would go to the dentist when I was a teenager. We ate so much candy, and I just don't know that my parents realized that that was a problem.
Oh, sure.
I am not kidding. Every time I went to the dentist, I had a filling. So I have mercury in every molar that I have. And one time, because I got a crown, maybe 15 years ago, they took out the mercury and not at all safely. Okay. There was no protocols. All that stuff was around my mouth and all that. So what is it that someone needs to be careful for? You're in Dallas. So if someone can come to Dallas, great. And they should go to you. So what is it that if somebody has mercury fillings, what should somebody do? Do we need to have them switched out? Do they leak?
So there's conflicting information. And what I was taught in dental school is different than what I feel like the evidence points to today. So in dental school, I was taught that was once those silver fillings were placed, that the mercury, they are 50% mercury. They're mercury in like a silver tin alloy. So what I was taught is that once those are placed, once the metals are mixed and it's placed in the tooth, that mercury is then chemically bound to the other metals in that filling and that it's essentially trapped. But what we know now is that there is actually some exposure, that mercury vapor has a really, really long half-life within that filling. It's got a half-life of 50 years. So even if you had your fillings done 50, 60 years ago, which is true for a lot of our patients, you're still going to emit a little bit of mercury vapor every time there's heat or friction applied to that tooth. And there's heat and friction applied to the tooth every darn day that you're alive, because you're chewing, you're brushing your teeth, you take a sip of hot coffee, you're maybe grinding your teeth at night or clenching. All of those things will release teeny tiny little bits of mercury vapor. And so this is where the term biological started, because we're looking at not just the germ theory of disease, but we're looking at the terrain theory of disease. And in biological medicine, we know that for some people, the mercury is no big deal. Your body can handle it just fine. It's not ideal, clearly, but your system can handle it. But if you've got a toxic bucket where you've been exposed to other chronic illnesses, other toxins in the environment, maybe genetic factors, whatever the case may be, if your toxic bucket is already full, then that mercury might be a little too much for you. And so it's very individualized. Not every person is the same, but the fundamentals of biological medicine is, what does the biological terrain look like? So as a dentist with a license that I appreciate and would like to keep, I cannot say that your amalgam fillings that are 50% mercury are harmful for you, because that would be a medical statement that I can't make. But I can tell you that a lot of the functional medicine doctors that refer patients to me want their patients to have those removed for any number of medical reasons that they might have. So I can't say that they are damaging in any specific case, but I can say that mercury is a very potent neurotoxin and that it's probably not great that it's in there. And I think that's at least not controversial enough anymore that I can safely make that statement publicly. Do I want any mercury amalgam fillings in my mouth? No, I don't. I had mine safely removed back many years ago. Would I ever allow someone to put a mercury amalgam filling in my child's mouth? That is a resounding hell no. As much as any other, that is a strong mama bear statement. Like, I think it's not a good thing. Does that help?
Yeah, it does.
I went to probably too many places.
No,
sorry.
No, it was great what you said. I think then the question becomes, like, I think about my mouth. I have 3 rows that have the mercury. I'd like to have them out. And I do know that some of my molars are pretty extensive with the mercury. So then would become the question of, would the tooth break in the process? Would I lose that tooth, then have to have a crown? So then there's that question. So yeah. But I really think that the big thing is that for those that are going to have them removed is that it has to be done safely. Now, when that happens, are there things put in the person's mouth to stop the absorption of the mercury in the mouth? And then are there also maybe some kind of binding agents that you give them to bind whatever goes into the gut? Are those some of the processes?
Mm-hmm. You got it. So I follow what's called the SMART protocol. And there's an organization called the IAOMT, and they are a fantastic resource for the public and for practitioners. So IAOMT.org, and they put together the protocol. What would also be interesting, I think, for your audience to look up, if you don't believe me, or if your dentist is like, hey, that's a bunch of crap, don't listen to those chicks, just look up on YouTube the smoking tooth video. There, you can just search for that and find several of these smoking tooth videos where it shows you how just this little amount of friction can release this mercury vapor into the air. And so we have to be very, very careful when we're removing those, because we don't want to expose you to any more mercury than absolutely necessary. And so we use layers of protection. And this is also available online, the SMART protocol. It's an acronym for Safe Mercury Amalgam Removal Technique. And so we do use things like binders. So we'll usually have patients rinse with an activated charcoal rinse before treatment and after. And then we separate the tooth. We isolate it with this, dental dam that we use. We use lots and lots of suction. We make sure that the patient is protected from head to toe. We have special air filters in the room to filter out any of the mercury vapor that's getting stirred up. So just layers and layers of protection to try to minimize this. Because I would say, again, for most people, if you have it unsafely removed, you are going to have a big mercury exposure that day during the procedure. And for a lot of people, their bodies can handle it and it's okay. But I've had, since I've been blessed enough to be able to help a lot of sick people who are really struggling, I've had patients, before I was doing the protocols all the way, I've had patients really go into a tailspin after getting these out, not following all the protocols. So I think it's important for us to be careful, especially if you've got some chronic illnesses that you're dealing with, so that it is done safely. And to your point that, yes, I'm in Dallas, but we do, again, IAOMT has a directory where you can look for dentists who follow the SMART protocol and do remove these safely. And I think it's worth a drive. If you have a dentist that's close to you that you trust and you love, you should stay with that dentist that you trust and you love, especially if, you can have important conversations and share your values and they respect your medical decisions. That's fantastic. And I see patients all the time who'll drive in or they'll fly in even and just camp out for a few days and get their dental work done and then go back to their dentist back home. And that's totally fine.
Wow, so interesting. Okay, the other questions that I have then, gum disease. So how do you manage that? What are your recommendations, or what do you believe are the drivers of that?
It's multifactorial. And so there are a lot of things that drive it. It could be, the normal, there's too much of the wrong kind of plaque buildup for too long, but sometimes it's completely systemic and there's very little oral hygiene that's involved. So it really depends on the patient, on what those multiple causes are. Sometimes it's hormones. Sometimes it's poor blood sugar control. Sometimes it is just an overall inflammatory response. So there are tons of studies linking most inflammatory conditions that you can think of. So rheumatoid arthritis, poor pregnancy outcomes, Alzheimer's, tons and tons of different health issues. Any kind of cardiovascular issue is correlated with a higher rate of gum disease. And it's cyclical. It goes both ways. And you really have to dig into that individual person's oral health to know, is this mostly a systemic issue that's just showing up in their gum tissue, or is it an oral issue that is then impacting these other systemic issues?
Yeah, and with osteoporosis being an inflammatory disease, it's usually my whole platform, or what I really go after, is that the gut and the mouth is the beginning of the gut. So the gut, and I think that I read something that we've been exposed since the 1970s to 84,000 pounds of chemicals. And so often these things are invisible that we're exposed to, yet what we feel is real, the symptoms that we're experiencing. So you just gave us some, thinking about off-gassing from mercury in your mouth. Maybe we wouldn't think of that. But the other ways that we're exposed usually with things that we put in our mouth, right? So it's the water that we drink, the foods that we eat, especially if we're not eating organic produce. Right. And I think that that's where education needs to come in. Are you recommending certain dietary things when you notice a lot of inflammation in the mouth and you're trying to go after systemic inflammation? Are there dietary recommendations you're giving to your patients?
Oh, absolutely. There are a ton of, as you know, there are too many choices, really, when it comes to diet and what's the quote unquote right diet for any one particular condition. But I can say, yes, if our oral health issues are primarily inflammatory and gum stuff is what I'm seeing the most of, then I'm focusing more on those anti-inflammatory foods and whatever that patient is willing to do, whether it's a Mediterranean diet, but I think increasing those micronutrients, decreasing those inflammatory foods like sugars and trans fats and things like that is the direction that we want to go. Now, if it's primarily tooth-related issues, if cavities are our biggest issue that we're trying to solve, then it's the same, but it is a little bit harder because it takes a lot longer for us to see improvements in tooth health when we're dealing with cavities and we're trying to fight that. Inflammation in the gum tissue, I can see a difference in that within a couple of weeks. Teeth, it may take 6 months or more to really, really see a difference. And so we're still focusing on nutrients, so lots of nutrient-dense foods, but we're making sure that they're getting a lot of healthy fats, a lot of healthy proteins, things that are rich in minerals, and then still, decreasing the sugars, the processed foods wherever we can.
Yeah, I don't think most people go to their dentist and get some food recommendations.
Well, they should. They should.
They should, you're right. Okay, other questions. So gums, where you see a lot of this. Now, in the osteoporosis world, the main drug that's given, the bisphosphonates, one of the side effects is osteonecrosis of the jawbone. So have you actually seen that?
Thankfully, I really have not seen much of that. The highest risk is from bisphosphonates that are given as cancer treatment by in IV form. Less likely to happen with daily oral medication that's taken for osteoporosis, thankfully, because obviously the oral medication is far more common than intravenous medication. But still, sometimes we'll see little necrotic lesions from old extraction sites where wisdom teeth were. We'll see these little traumatic bone cysts on a 3D x-ray that we take. And sometimes those need to be cleaned out so that it can then heal properly. Thankfully, I have not seen myself in my practice a true osteonecrosis of the jaw where we were needing to make a referral to oral surgery for something major, thankfully.
Do you ask that question when you're working with someone? Is there a question that you ask about bisphosphonates? Is it mostly bisphosphonates or is it all the osteoporosis drugs?
Bisphosphonates.
Okay. And then the other question I have, let me see. I was just what was I going to ask you about? Something. Oh gosh. Okay. I'll come to that. I'll think about what else I was going to ask you because it had something to do. Well, I just want to tell you a story. I had a podcast interview with a woman who did go, I believe it was bisphosphonates she was taking. And I don't know if she did a couple of other drugs in between or, before she did the bisphosphonate, because that's the thing with osteoporosis medications. You can only be on them for a short time, and then you need to try the next one. But she actually started to have shards of bone coming out her gum line and had to go into the dentist, and they were picking out the shards of bone because she actually was experiencing the osteoporosis. So, okay, the question I was going to ask you is this, because you were saying something. When you were talking about the cancer drugs, did you mean cancer drugs for cancer, or were you talking about the SERMs, which are also part of the class of drugs that can be used in the bone health world?
Oh, no, because I don't have experience with those. I'm only talking about like chemotherapeutic agents.
Oh, okay. Because, there is one of the drugs in the bone world was used for chemotherapy. They're called SERMs, SERMS, like whatever that is, whatever that stands for. And I don't get into the medication too much in the bone world. I let the doctors that I interview talk about meds because I don't prescribe or recommend or whatever. So I let them speak about them. I know enough of what I need to know about. But you made a comment about the injectables versus the oral. And what's really interesting with the injectable medications is they have this time released aspect, right? People are giving themselves either like a once every 6 months, once every year, sometimes once every month, which is just so crazy because there's so much more intensity, I think, of a medication in your body when you're doing it injecting. And then the fact that you have to only get it done every year or every 6 months, it just seems so intense to me.
Yeah, it does. You're right.
So and you're saying that you're seeing the injectables be worse. Okay, the other area I want to go to then, I'm just trying to think of what is it that we go to the dentist and have done? What is it that we need to be careful of? What are your recommendations when it comes to biologically and healthfully taking care of your mouth?
Mm. Well, two big ones are fluoride is not an essential nutrient, so you don't need it. Yes, there are forms that are naturally occurring. Fluorine is on the periodic table, so it is natural. But the forms that are in our water or in our toothpaste is not natural, and it's not essential for tooth health at all. So you don't need fluoride. And I really think that this science is increasingly concerning on the risk level of fluoride, especially in our water, especially for our children. So even adults in perimenopause, menopause, and older, there's still evidence that it's riskier than we once thought it was. So I would say, for one, don't worry about, you don't need to use fluoride. The second is a lot of the mouthwashes and products that you see over the counter are really damaging to that delicate microbiome that you and I both know is so, so important. So any kind of mouthwash that has alcohol, if it burns, it doesn't necessarily mean that it's working better. It just means that it's probably killing a few oral mucosal cells and killing all of your good bacteria along with the bad bacteria. So knowing that you don't have to use a mouthwash to have a healthy mouth, I think that is very important. And really, oral health can be very simple if you start with a good, clean slate. I'm not saying avoid the dentist, because I think we need to get to a place where things are in balance. But once they are, you've addressed active gum disease, you've addressed active tooth decay, you've restored teeth to their proper function if something's broken, then maintaining it can really be pretty simple. A soft toothbrush just to disrupt the biofilm or plaque that forms on your teeth every day. You actually don't need toothpaste technically. If things are in balance and things are healthy, you don't need toothpaste, just a toothbrush and water. It could be as simple as a saltwater rinse on occasion to reduce bacterial levels a little bit and help promote healthy gum tissue that's less inflamed. So all of the chemicals and potions that we use sometimes they can be really helpful in the short term. And I have my favorite, more natural versions of those. They can be so helpful, but you don't necessarily need them in the long term. So just knowing that your mouth is a balance, just like the rest of your gut, it's all this delicate balance. And we just need to be careful when we're trying to throw different chemicals and therapeutic agents at it.
Yeah, that's really great to think about that raised awareness piece. What about oil pulling?
I love the idea of oil pulling. Have you ever done it yourself?
Yeah.
I don't have the patience.
Well, do we have to do it for 10 or 20 minutes? So that's the thing. I've studied in India. I've studied yoga therapy. So in Ayurveda, when they're recommending it, I want to say it's like a 10 to 20 minute process.
Yeah, it is. So like I said, I love the concept. There are very few studies on this. The ones that I have read, there are mild positive effects of oil pulling. It's usually decreased plaque levels, decrease in inflammation is what we see with frequent oil pulling. When I see patients in my practice who go from not oil pulling and then they start oil pulling, 6 months later, their mouths will look healthier. And so I see a positive result clinically. But I personally don't have the patience to do it. I wish there was more data on coconut oil pulling. That's not the Ayurvedic treatment. In Ayurveda, it's primarily sesame oil is my understanding, right? And so that's, if you've ever tried oil pulling with sesame oil, it's not very tasty. So because I love it in concept, but in practice, am not personally a fan. So we have methods and rinses that can still do the same thing in a little bit less time and without clogging up your sink.
Yes, for anyone listening, if they're wondering what is oil pulling, I always did learn it though with coconut oil. And I'm not sure traditionally what I was trained in when I was in India. So I don't remember. I just know that coconut was the easiest oil to use. So typically you heat up
It's the
and
best. Yeah.
yeah, you heat up and liquefy oil and you swish it in your mouth. And I want to say it's like 10 or 20 minutes. You try to
Yeah.
get it to go between the teeth, and it's supposed to be healing for your mouth and for your gums.
Yes. I wish there was more data on it. Like I said, I'm a proponent if anyone has the patience to do it.
Well, the fact that you said you see results, positive results in people's gums, and I'm going to say that that is what people who do it tell me that they've noticed a difference.
Yeah.
Okay, another question. So I do get my teeth cleaned every 6 months. I think that I do really well with my teeth now. I use an Oral-B toothbrush because when I was 20, and I told you I've had fillings in almost every molar that's in my mouth, the dentist told me if I got an Oral-B, the round circle toothbrush, the motorized one, that I would never have another cavity in my life. And it's like 30 years later, almost 40 years later. And to be honest, I haven't had that many cavities since that point.
Yeah.
And so I have used that. But my question is, I go get my teeth cleaned and I'm sitting there and they're scraping on my teeth so much. Now, she always says my teeth look great. When she talks to the dentist, she goes, it's like ice skating. So my teeth supposedly are really good. And they tell me I only need to go once.
Babies. Yeah.
Yeah, they say once every 6 months. So
Uh-huh.
I'm in that category. But as she's scraping, I'm like, what is she scraping and what is she getting off? And is this necessary? Do we really need that?
So I would say yes and no. Yes and no. I think that for one, I think having a checkup twice a year is fantastic. Probably what she's scraping, if there's anything to scrape, now it sounds like your oral hygiene is excellent. There's very little to do, but what she's feeling for is she's feeling for any tiny little spicules of what we call calculus in the dental world. Most people call it tartar buildup. And tartar buildup is just when plaque calcifies enough that it becomes hard and it adheres to the tooth. And so removing that from around the gum line and especially just below the gum line is really important for preventing gum disease. Now, if you have pristine, clean teeth, you're removing the biofilm daily and you're doing an adequate job of it. Is it prudent for you to only go once a year? Probably, but I would say that's for patients who have a long history of no cavities and no gum disease, and they have little to no tartar buildup when they go in for their cleanings. What's interesting is that, hygienists do such an amazing job at removing the biofilm and making sure that the gum tissue is pristine, that there's none of that plaque or tartar buildup around the gum tissue. Once you leave the dental office, it only takes 30 minutes for the biofilm to start forming again on your teeth. So what I try to teach my hygienists to keep in mind is that yes, it is important to remove tartar buildup that a patient can't remove on their own. But what I stress is that we're really not doing our job if we're spending the whole appointment cleaning instead of educating our patients. Because in 30 minutes, their microbiome is going to do what their microbiome is going to do, and it's going to start forming again. So yes, it is important. It's needed. And we just try to keep a very balanced view. Do we need to be scraping for 55 minutes out of an hour-long appointment? Probably not. Not on most people.
Yeah, it's very biologically dentistry of you. So, Tony, are the teeth made out of the same substance as the bones? Is there a similar makeup between teeth and bones?
Similar, similar. We have different layers of tooth structure, and those layers are different than the layers of normal long bones. We have an inner layer that is very, very vascular, similar to bone marrow, where the blood vessels and the nerve of the tooth lie. And so that's what's called the pulp of the tooth. And that middle layer, the dentin, is primarily collagen and then a little bit of that calcium hydroxyapatite crystalline structure, just a little bit. That takes up the bulk of the tooth. And that is probably the closest to the rest of our bones. And then our enamel is very different. Our tooth enamel is primarily hard crystalline structure. It's this calcium hydroxyapatite crystal that makes up most of the tooth enamel. That's why if you ever get a little bit of gum recession, the part that starts to recede, the part of your tooth that you can then see, it's a little bit yellower and it's a little bit softer. So it wears away a lot faster and you'll get these divots within the tooth. And it's just because it's exposed dentin. Instead of that hard enamel that's supposed to be exposed, the dentin just wears away as softer. And because it is less of that crystalline structure, it's a little bit darker in color too.
Oh, yeah. It sounds like you're talking about collagen and calcium, and it's just very much a lot of the what
Same
makes
building blocks.
Yeah, same building blocks.
Building blocks.
So, question, are there certain foods you recommend to support teeth, to have the strongest teeth possible? Is that even something, is that a possible? Okay, because then I want to hear what those are, because then that's similar to bones.
Yeah, I really want people to focus on healthy fats and proteins, because most of the minerals and vitamins that are essential for tooth health are going to be fat soluble. So I really want to make sure that they're vegetable-based fats if possible. Your coconuts, avocados, and olives, and things like that. Cod liver oil is fantastic for tooth health. So any kind of healthy fat and healthy protein is going to be great for tooth health. And then if we're supplementing, then a lot of times we'll have patients supplement with some cod liver oil, make sure that their D3, K2 levels are optimized, and magnesium can be really important too.
What about calcium?
Calcium's tricky just because we don't want to take too much, because it really needs those other D3, K2 and magnesium to point it in the right direction. So I don't know that I would ever recommend, at least not anymore based on the science that I know now, I don't recommend a calcium supplement. But I think it's always good to make sure that we have nutrient-dense foods that happen to support healthy calcium levels.
Yeah, so the recommendation here for women over 50 is 1,200. However, that's actually not correct. And the studies are actually starting to show that. They've done studies in New Zealand and in Europe.
High or too low?
Too high. So in the UK, they recommend 700. Mm-hmm. And when women are trying to get the 1,200, it's just so hard that they're using calcium supplementation. And it's really a matter of keeping calcium in the bones. It's the internal balance that's going to keep calcium in the bones. And when calcium's not in the bones, if it's in the soft tissue, it coats the heart and the blood vessels. So I don't recommend calcium supplementation. And when I asked you about what you need to feed your teeth, it's exactly, those are the 4 musketeers of bone health. The 4 musketeers, calcium, because 99% is in the bones. So you need the calcium, probably the rest is in the teeth. And you need the calcium, right? You need the vitamin D3 because that's what helps it get absorbed. You need the magnesium because it puts the calcium into solution to be delivered to the bones. And the vitamin K is what cross-links the calcium to the bones. Those are the 4 musketeers of bone health. And it sounds like they're the 4 musketeers of tooth health.
Absolutely.
Wow.
And so when you're guiding people on their vitamin D levels, what kind of vitamin D level do you like to see?
Well, so I interviewed a functional physician on this, and she said when she puts on her regular Western trained traditional MD hat, even 20 and 30 in serum could be considered okay. I know. When she puts on her functional hat, her functional medicine doctor hat, she likes to see it above 50. And then she said, as an obesity specialist, she likes to see it above 70. So what I've always heard is 60 to 80 is optimal. Over 50 is better. But however, sometimes even around the 40 can be good, because when you supplement with too much vitamin D, which is what I see, that's going to affect magnesium negatively. And we already see such a depletion of magnesium. That's one of the minerals I think most people are depleted in, which is going to lead to cramps and not sleep well, poor energy production, because our cells use a lot of magnesium for cellular energy production. So over supplementing with vitamin D is not great. And I've also read or learned that we don't even know if the serum levels of vitamin D are accurate, if it's a true indication of what's going on internally. So it might be that we're falsely elevating serum vitamin D with the supplement. So here's what I think. I think that there's a lot we don't know, to be honest.
This right here, I love this statement that you just said, because I was just talking to somebody last week on a podcast interview that we did. I think probably the most important thing, the most important trait that we can have as healthcare practitioners is just a little bit of humility, that we don't know what we don't know.
And we don't know a lot. That's the whole thing,
There's
because
so much. Yeah.
this is what I always say. Okay, so the vitamin D goes in your mouth. You're taking the supplement. First of all, vitamin D and vitamin K are mostly found in the animal world. So what does that mean for all the people that are vegan and vegetarian? Because there's a lot of them. So what does that mean for them, right? Or vitamin K in natto, which is only in Japan. Does that mean that just those people in the world could have the best bones possible? When in actuality, Asian women and Caucasian women are the ones that have the worst bone health or detectable bone health on the DEXA scan, which is a whole other topic. So do we follow that vitamin D supplement in our mouth? Can we tell if it gets absorbed? What are the other factors that are going to get in the way of it digesting, of it absorbing? Where does it get delivered to? So I'm going to say, when people ask me these questions, I'm like, we really don't know much, because this is a intelligent, multicellular, 70-celled being that is affected on so many levels by so many things. So we do the best with what we can know or try to put our finger on.
Absolutely.
Yeah.
Absolutely.
All right, Toni, this has been so informative. I learned a lot, and it's really interesting. I don't have these discussions with my dentist. I love my dentist. And you know what's really crazy? He had a very rare form of cancer. And I always thought it could potentially be all the toxins that he's been exposed to throughout his career. I'm sure it is.
Exposed to a lot. Yeah.
Yeah. So thank you. You've educated us a lot and gave some really good suggestions there. That'll be in the show notes, the SMART acronym and the other organization to look for, a biological dentist. Hopefully what women have learned listening to this is how educational, how in-depth, and how holistic your approach is to dentistry.
Oh, thank you so much. This has been so fun. We could talk for another hour. We'll have to do it again.
Part 2.
Part 2.
That's it. Okay, so thanks so much. And I'll have all the information on how those that are fortunate enough to be in Dallas, how they can find you and learn a little bit more about your approach. So thanks so much for coming and sharing your wisdom with us today.
Thank you, love.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.